The hip joint is the most important joint of the body, which lies between the acetabulum or the hip gluteus bone and the thigh bone. It has a ball and joint or ball and socket joint. The ball and socket joint is the most important part where the 70% of your body maintains its activity. It's where the weight of the body. You can see this is the ball and this is the socket, which forms a joint called hip joint. This hip has vulnerable to many problems like arthritis. In arthritis, you have a degenerative arthritis, septic arthritis, tuberculosis arthritis, and avascular necrosis of arthritis, and other like traumatic arthritis. These are the various arthritis vulnerable for this joint. So, joint is such a heavy joint which maintains the structure of a thigh, hip, leg. So, in this joint, when there is there will be a cold orthopedics like rheumatoid or immunological disorder leads to pain of the hip joint. A immunological disorder like rheumatoid arthritis or viral arthritis leads to hip pain. When there is a trauma to this bone, there is a possibility of developing arthritis in the hip joint, leads to a multiple problems like dislocation of the joint and damage to the soft bone of the joint, and there is a degeneration of the hard bone of the joint. So, along with this, what type of problems usually people get is, after the age of 45, there is a deficiency of calcium and vitamin D, leads to degeneration or damage to the head of the thigh bone. So, when there is a degeneration or damage to the head of the thigh bone, the movement in the joint will be restricted and painful. So, obviously, when we see that it depends on the stage 1, 2, 3, 4. The stage 1 is like a synovitis, which the medicines, after ruling out by a basic investigations, X-ray, CT and MRI, we should diagnose the problem and then treat accordingly. When there is a degenerative osteoarthritis in stage 1, 2, can be managed with tablets, painkillers and then physiotherapy. When the damage is more like stage 3, 4, then sometimes it required internal injections. If not, then plan for a total joint replacement surgery. So, in hip regions, these are the multiple problems. Who gets it will sustain the problems, and then we should understand the disease modularity so that treat the patient. The AVN is avascular necrosis of the joint, leads to a erosion of the joint and the soft tissue of the joint. Thus, he gets the pain, deformity and movement is restricted. So, when we learn something about a hip joint, then there is a septic arthritis because of the trauma, hematoma and clot, and the infection also lead to septic arthritis. Then there is a possibility of tuberculosis arthritis. A tubercular bacilli in the lungs may transmit to hip joint, and then the hip joint fluid will be affected with the joint tissue. So, this is the way we see a multiple problems in the hip joint, where we should be diagnosed properly and perfectly to treat accordingly.